when to do the tummy tuck. Tummy tuck is not for people who have a big tummy.
Tummy tuck is the Control-Alt-Delete button for the tummies.
I'm sorry, ladies, get an excuse, not to go to the kitchen.
OT के अंदर exactly what can somebody expect?
They can expect to sleep nicely. Okay? Common myth is you have a surgery, now you're on bed rest.
Hey everyone, welcome back. So let me share a story today about one of my clients who is about 7 months pregnant and she's just waiting to get done with her second pregnancy so that she can undergo a mommy makeover. Any of you out there who've ever heard this phrase mommy makeover and want to know more about it? Today we've got Dr. Sanjay Parashar with us. Let's try and get to know sir as much as we can about what mommy makeover is. So what is mommy makeover?
See, mommy makeover is an interesting term which came about where women went through, of course, goes through a lot of changes during the pregnancy.
Right.
So initially, mommy makeover was thought to be just related to tummy improvement because of pregnancy. The skin stretches, there are a lot of stretch marks, the muscles become weak. So to tuck that, tummy tuck was the term that was very popular. But then it was realized that it's not just the tummy that goes through changes. There are a lot of other changes that happens during pregnancy. The breast changes, the body changes, the face changes.
Right.
So obviously women want to, after pregnancy, be like what they were before pregnancy.
Right.
Fair enough. So mommy makeover involves a lot of these different corrective procedures that can actually make them look more youthful and like what they were before pregnancy.
So what exactly does tummy tuck mean?
So tummy tuck means tucking the tummy. It's like tucking your shirt.
Like a waistband of a pant.
Well, yeah. But it sounds easier than actually it is done. It's a technical procedure where we correct changes that happen during pregnancy. So what are these changes? So obviously when the babies grow, the
Skin stretches.
And when the skin stretches, in a short period of time, there are stretch marks.
100%.
And then after delivery, the skin is weak and not strong enough to shrink back.
Right.
And usually it happens after multiple pregnancies. Let's say after first pregnancy, the tummy will return back in most of the people. And particularly if they are maintaining good health and exercising,
Right.
But then with multiple pregnancy, it becomes difficult.
I've noticed, Dr. Sanjay, that people who end up gaining a lot of weight, even if it's their first pregnancy, they end up gaining more than 10 or 12 kgs of weight, also suddenly have a lot of sagging skin post-pregnancy. So multiple clients that I've had are just post their first pregnancy and they've got a lot of sagging skin and that troubles them. Do those patients also qualify for tummy tucks?
Yeah, so tummy tuck is for people who have not just sagging skin, who have extensive stretch marks. So, sometimes sagging skin, we know if we just cut down on the fat or remove the fat, either by exercise or by even liposuction, the skin has the capability to shrink back. So they may not necessarily need tummy tuck. But if the skin quality has become poor, like the stretch marks, if they've developed stretch marks, and other than skin, if the muscles become very weak, then these things needs repair. So a combination of repairing the muscle, removing the fat, tucking the skin is called tummy tuck.
An ideal patient for tummy tuck would be somebody who's got stretch marks, somebody who's got a little bit of sagging skin, somebody who also requires muscle correction. So tummy tuck and abdominoplasty then in that case is the same thing?
Yeah, so abdominoplasty is a scientific name for tummy tuck.
Right.
And it, like you said, if there is minimal sagging, there is a minimal tummy tuck. It's called mini tummy tuck, for example.
Right.
Or if there is excessive sagging, then obviously it requires a bit more tummy tuck or an abdominoplasty.
Is it only for women though? Is it also you've heard of mommy makeovers, but have you also heard of daddy makeovers?
Yeah, that's very interesting. I've never heard of daddy makeover, but I think why not? Of course. I'm actually looking at myself now, just trying to. But daddy, yeah.
Yeah, I mean you go from God bod to dad bod post marriage for a lot of men.
Absolutely.
But I don't think anybody wants to go from dad bod to uncle bod. So how do we, sort of come back from the uncle bod?
I can very well relate to you. So yeah, you are right. Also men goes through hormonal changes.
Ji.
Okay, with time.
Right.
And when I say hormone, doesn't necessarily mean testosterone and estrogen, progesterone. Also mean insulin resistance. So all of
Right.
these work on men's body as well. The testosterone becomes low, of course. So that the body fat deposition pattern changes, and they also undergo changes like, of course, double chin, changes like fat in the chest area, changes like tummy fat. And
Right.
when it grows more and more, the skin tends to become saggy. And not these changes. There are other changes as well. Changes in the skin. The quality of the skin changes. When you are young, when you're in your 20s, your skin is nice and shiny.
Bounces back,
Yeah,
yes.
but as the age advances, the skin doesn't behave very well. Loss of hair.
Right.
You develop baldness.
Right.
So all of these makes one look a dad bod or
uncle bod.
So there are
Yes.
corrective procedures for them. So yes,
Yes.
the answer is tummy tuck is also for men.
Is it more for men who have undergone a lot of weight loss? Because I often get a lot of people who have started on their fitness journey, they've lost 20, 30, 40 kgs, from that such a century, they've come to half century now and they're in a good place. But despite all of those changes, the one thing that still stops them from being able to dress the way they want to is all of this, skin and the fat that they can't seem to get rid of. So would they also benefit from tummy tuck procedures? Is that something for them? Is that something that will help?
There are two kind of procedures that is done for that problem. One is we remove just the fat called liposuction.
Right.
Where we don't touch the skin. It's just the fat that is removed. And the other one is tummy tuck, where we remove the skin to tighten the skin. Now what happens in some individuals, particularly in a younger age, or if they don't have a lot of fat, or if they have not gone through a yo-yo process on their body where they have gained, lost, then the quality of the skin is good. So in such people, if they really work hard, they exercise, they control their diet. If not, I do liposuction on them.
Yeah.
The skin shrinks back.
Find it very difficult to believe that any Indian would not have had yo-yo phase at some point in their lives.
Everybody, me too.
Is-
Everybody goes through
Every
that.
time
Everybody
Diwali
goes through
comes
that.
and the Shera comes,
Yes.
you're struggling to keep yourself away from all the sweets and the rasmalai and the rasgulla and the gulab jamun. I personally struggle with that as well. So everybody at some phase or the other has gone through that yo-yo phase. So for them, I understand that you're saying that it will become a little bit more difficult to sort of undergo these.
So first thing always is to, once you've, indulged into all of this Diwali celebrations, is to get back to normal. So that should be a period of detoxification.
Right.
Where you detoxify yourself. Throw away or take away the rasgullas, move away the gulab jamuns and all of those things. And be a bit more serious about what you're eating,
Right.
So there is a way that you can lose those extra fat.
Right.
Now, sometimes you cannot lose everything, all of it. And then you end up having a little flab here and a little flab there.
Right.
So in such situations, you can do just liposuction to correct them.
Right.
Tummy tuck in men is done only when the skin, when somebody has really become obese and they have lost weight either by dieting, exercise or some bariatric procedure,
Right.
and then they have a lot of sagging skin. Those men need tummy tuck. Otherwise, men generally do not need tummy tuck, fortunately in a way, like women do.
So what can somebody expect from a tummy tuck procedure in terms of, their preparedness? मुझे क्या पता होना चाहिए, मेरा recovery time क्या होगा, मुझे क्या cost पड़ेगा. तो हम, if I have to, explain to somebody what a tummy tuck procedure involves, मैं उनको क्या समझाऊंगी?
So tummy tuck में सबसे पहले important ये रहता है कि आपका physical fitness है कि नहीं for that procedure. So we will do the medical tests, make sure their health is good, check on their medication, all of those things.
Do they also undergo like a stress test?
Well, they do. The husbands can undergo stress test because eventually they have to shell out their money. So yeah, so once the medical fitness is done, then we plan for the surgery, and then they have to take time off, of course.
Right.
So usually the recovery is about 6 to 7 days. In 6 to 7 days, with the modern technique that we use,
Right.
people are able to get on with their laptops and with their telephones and be, on the go. Not so much physically, but at least from work point of view.
6 to 7 days is not bad.
And about 2 weeks, 3 weeks, most of them are physically able to travel around
Yeah.
and do their works and jobs, So that's the recovery period. Obviously, it's also important that after the recovery period, they continue to follow with the doctors. Because the doctors
of
will
course,
advise them to, follow a healthy lifestyle, to maintain on the results and to improve on the results.
So they continue to improve post the surgery for weeks to months?
So they continue, it's a lifelong journey. Okay.
Right.
When it is said that when you have undone the past, you have to build a new future.
You sound like, all of those, all the memes and all the posts that we have about healing from different kinds of trauma. So, no, but that is true. It is, yes.
Yeah. So it's a lifelong journey.
Right.
So it's like, what's gone is gone now, and let's have a healthy lifestyle now.
Right.
And this is where, of course, they need our doctor's support to advise them on a correct method to make sure that they maintain.
Yeah.
But they have to maintain it.
So 6 to 7 days is definitely not that much time for me to actually be back to my daily activities. And in about 2 weeks, most of my swelling, pain, everything is gone. Do I also start doing a little bit of exercise by the end of 2 weeks?
Oh,
like
absolutely.
walking?
I, in fact, insist on exercising after 2 weeks.
Yes.
So what the common myth is, you have a surgery, now you're on bed rest.
Right.
And that's also, I'm sorry, ladies get an excuse, not to go to the kitchen or to help them with husband or whatever. But that should not be the way. They should be up and about the next day itself. They should be able to move around in the house, do a little bit of physical activities, because activities improves blood circulation and improves healing.
And it will reduce the swelling
It
further?
reduces the swelling faster.
Right.
It makes them more comfortable faster.
Right.
So in 2 weeks, I tell them to start going out for a walk.
Right.
So they can go for a walk, or even inside the house to walk around in the house, climb stairs up and down slowly, and based on their tolerance, gradually increase it. So I start after 10 days or 2 weeks after the surgery.
But if someone has a very active lifestyle, fitness used to be a fad and now it's the way of life for a lot of people. They love doing weights. So if somebody is undergoing a surgery like this, when can they, especially with the tummy tuck? I believe in a tummy tuck there is a certain, surgical component involved जहाँ पर sutures वगैरह रहेंगे. How much time before they can start pushing iron again?
So what we do nowadays is we use all dissolvable stitch. There are no stitches that needs to be removed.
Okay.
They're all underneath the skin. There's no visible stitches outside. So they dissolve. They don't have to take any special care of that. Okay.
Right.
So it heals much faster. So what happens in like I said, in 2 weeks they start some exercise. In 4 weeks to maximum 6 weeks, they get on with training, gym training. So they can start doing training for the arms, for the biceps, for the thighs. The core muscles gradually in 6 weeks time. Once the muscle is healed well, we encourage them to start core muscles. And in 2 months, they are ready to lift as much weight they want.
So is there any particular thing that you would be advising somebody against? Like tummy tuck इनके लिए तो 100% नहीं है, या फिर tummy tuck का procedure आपने कराया है तो ये तो बिल्कुल भी मत करना. And then eventually, some precautions like this, because it's a general question in their brain कि अगर मैंने ये कराया तो मैं ऐसा कुछ है कि जो long term नहीं कर पाऊंगी अब.
सबसे पहले तो क्वेश्चन था कि किसके लिए नहीं करना चाहिए टमी टक.
Right.
Tummy tuck is not for people who have a big tummy. Okay, that's a big myth that people have. कि बड़ा tummy means tummy tuck. No. Have you heard of a word called pot belly or beer belly?
Yes, that is.
So beer belly means the fat is accumulated inside the tummy where you have your organs, जैसे liver है, visceral fat.
Right.
Now, जिस किसी का भी visceral fat ज़्यादा होता है, भले वो male हो या female हो, tummy tuck is not going to benefit them at all. Okay, that's the first thing.
This is unfortunately very unhappy news for people who thought tummy tuck is a control-alt-delete button for their tummies.
It's not, absolutely not. So the first step is always to lose that fat.
Okay.
But the good news is that fat is very easy to lose. You stop the beer, you stop all the sweet things, it will disappear.
You'll have to stop being Indian for that.
Let me tell you, but in scientific way, that's very true.
Yeah.
The belly fat or the beer belly fat or the fat is very, very easy to metabolize. The moment they control all of these excess calories, it will start metabolizing and they'll become flatter and flatter.
Right.
The stubborn one is the one which comes outside the belly. That becomes difficult, and that's where we are needed as plastic surgeon. So that's where we don't do tummy tuck. So of course then we have to prepare the person for tummy tuck, do the blood test and all of those things. But after tummy tuck, there's nothing that they cannot do. They can do pretty much everything. The only thing we don't recommend them to become pregnant again immediately.
Okay.
Now this is a very important decision that we have to make with the client or the patient. When to do the tummy tuck. So the ideal time is when they have decided that the family is
now
complete,
complete.
and they don't want to have any more children. That is the correct time to do a tummy tuck.
If you decide to get pregnant, it has to be after this much time.
We say at least after 1 year or even 2 years. But if you have already planned a pregnancy after 2 years, I still wouldn't do tummy tuck. I would say wait. If somebody says, no, maybe 5 years I'm not going to have another baby, then fair enough, you can probably do. But still, I feel do it only when you have decided that the family is complete.
Even for the men?
Well, for the men, it doesn't matter so much, They can do whenever they like,
Right. I mean, whenever you decide that you don't want to have an uncle bod and you want to have, if not a god bod, then at least a dad bod, you can decide that. But do you often find men as patients who require tummy tuck? Because pot belly in general is more common in men, in my experience. All the beer, all the
You're
whiskey.
right. Yeah, absolutely. Yeah, pot belly is more common, unfortunately, in men.
Yeah.
But tummy tuck definitely is not an answer to them. They have to go through weight management.
Yes.
Absolutely. Sometimes even liposuction is not a solution for them. Liposuction is done only when the percentage of fat is more outside the tummy than inside the tummy. Then we recommend liposuction.
Right.
If not, we don't.
Right. So when we're talking about outside the tummy and inside the tummy means the fat you were mentioning.
The visceral fat.
The visceral fat, which is around the organs. And outside the tummy means the fat which is
underneath the skin that you can grab.
Right.
Like a flab.
The skin, yes.
Yeah.
In a tummy tuck procedure, OT के अंदर exactly what can somebody expect? कि मेरे साथ क्या होगा? And when I wake up, what exactly would be the surprise that I'd be giving?
They can expect to sleep nicely. Okay? Because they will be in sleep. They will not know what's happening. All right?
This is the answer to all the insomniacs out there.
So they'll sleep very well.
Right.
But as surgeon, what we do is, so there are steps that we follow.
Right.
Okay? The first most important step is we inject some fluid to make sure that the fat that we are planning to remove is soft.
Okay.
Okay? And this also makes the procedure less traumatic. So there's less bleeding, swelling, and all of those things. And then we do liposuction. We remove the fat from the waistline, from the back, from the front of the tummy.
The good part, yes.
Yeah, and then we go from an area where normally a cesarean section is done, which is low in the bikini line, underneath the skin. Okay.
Right.
Then we disconnect the belly button to reach all the way up here to find the muscle. It's just like a tunnel that goes underneath the skin.
I lose a button, but then do I gain that button again?
No, that's your own button that we are going to make it more youthful.
Okay.
So we go there and then we tighten the muscle. All right. And the belly button, which is, just imagine a button of a shirt.
Right.
Which is on the muscle, is brought out from a new spot after pulling the skin and removing the extra skin. And then the stitches are placed in that belly button and in the bikini line area. So that's what happens during tummy tuck.
So not only do I get a new tummy, I also get a new belly button.
You get your own belly back in a new way.
How long would that, sort of suture line be? Is it all the way throughout your waist, or is it just a small suture line at the lower bikini line?
So it depends on how much of the skin excess is,
Okay.
So mini tummy tuck is where it's just a short scar, like a size of a cesarean scar, maybe a little bit bigger. But if there is a lot of flab which is going into the waistline, then the scar is slightly longer. But it is from one hip bone to the other hip bone. And it's within the bikini line, so it hides well.
And how long does it take for these sutures to heal?
It takes about 2 weeks to heal completely,
And then post that long term, will these scars be visible? The suture line, will it be visible, or it goes away completely?
Yes. So that's an interesting question. See, any stitch wound forms a scar. Okay?
Yeah.
Now, scar can be a good scar. Now, when will be that a good scar? When it's just a very faint line.
Okay.
Or it can be an ugly scar which doesn't look very nice.
Right.
So that also depends on many factors. And one of the most important factors is the surgeon. It's like stitching your shirt. If I am altering your shirt or your top and I'm trying to make it very tight with a very tight stitch line here, and you wear that, what will happen to that stitch line? उधड़ जाएगा. उसी तरह scar भी उधड़ते हैं.
Right.
Okay? So the key is just to alter it to fit the body.
Right.
Not trying to make a celebrity body out of one's body. and pulling it, tightening it, because that will have a counter effect on the skin.
Yeah, I mean, I can't try and make it so tight कि ऐसे लगे कि मैं corset पहना रही हूँ and उससे
Correct.
fat
And you're
कम
not
हो
able to
जाएगा.
breathe well, and you're not able to stand straight. Then the
Right.
scar stretches and the scar looks bad.
Right.
The second factor about the scar is the healing capability of the person.
Right.
Of course, people who have diabetes or people who have other health issues, they don't heal very well in time. So it takes time for them to heal, and the scar doesn't form as good as it would form in a normal person. So there are some of these factors that decides the look of the scar. But any scar in the body over a period of time fades.
That is
Okay?
true.
So sometimes tummy tuck scar after a year is hardly visible. But in some people it may be visible, and it may require some treatment like laser sessions or some injection treatment, or there are even some creams or sheets that can be applied over the scar to improve the scar.
I mean, it's an interesting thing that you said. It's true for life as well. Or all scars heal and fade eventually. That's a good thing. So, for people who don't have a natural tendency to heal well, either diabetics or even smokers for that reason,
Oh, absolutely. Chronic smokers, yes.
Chronic smokers, they don't
Yeah.
heal well. Vitamin C deficiency, you guys. So, and their collagen is not good. Do you do something to make sure कि उनका scar और अच्छे से heal हो?
Yeah.
Is there a way that we can do something apart from the fact having a good surgeon definitely counts, but उनकी skin की healing ability को क्या हम improve कर सकते हैं through any methods?
Yeah, so you can improve. Smokers need to stop smoking before and after the surgery. Okay.
Yes.
Obviously, taking vitamin, particularly vitamin C, will help them heal
Yes.
better. Later on, after the surgery, we do recommend them take multivitamins or vitamin E,
Right.
or even collagen supplement, which will also improve the scar. So there are a lot of these support treatments that can be given to improve the quality of the scar.
We'll just touch on this topic briefly, but does stem cell therapy in general make impact towards healing those scars better?
Yeah, so a lot of times what we do is, particularly in people, if we believe that their skin condition is not favorable for scars and they still want to do a tummy tuck, what we do is during the surgery we inject stem cells, which is taking out of their own fat cells.
Yes.
And those are injected in the scar. So what happens with these stem cells? They control over inflammation, inflammation is the problem of everything in the body, as you know.
Right.
That's also for the scar.
Yeah.
So to reduce the inflammation, we use these stem cells, which has growth factors which control these inflammation and reduces that excess scar and controls the scar.
That's a lovely way to reduce scarring and improve body's natural tendency to heal using your own body's cells. So coming back to what we were just talking about, and a very interesting thing that you touched on is the importance of a good surgeon. So one of the most commonly asked questions is कि मेरे ट्रीटमेंट का कॉस्ट क्या होगा, मेरे ट्रीटमेंट के लिए जो मेरे सर्जन हैं वो कितने एक्सपीरियंस्ड होने चाहिए, नहीं होने चाहिए. Do all of these factors play a role in the outcome of my procedure?
So all of these play a factor in both, in the cost and the outcome.
Right.
Obviously, to get the best result, you need to use the best quality products.
Yeah.
I could use any thread versus I could use the best quality thread which will have minimal reaction.
Very true.
And that's where the cost is involved.
Very
And obviously the experience of the surgeon as well. The years of experience that the surgeon had, the technical skills that the surgeon has, the efficiency that the surgeon has to perform that surgery in a period of time that will allow the person to heal faster.
Right.
All of these things matter.
So overall, should somebody then decide based on मेरा surgeon 10 years, 15 years, 20 years का experience है, उस पे आपका decision रहेगा कि या फिर कि ये मेरे budget में है, ये मेरे budget में नहीं है? How does somebody decide कि मैं कैसे ये surgery करूँ when they are not sure what to expect in the end?
See, I know this is a very difficult situation. Obviously, more the experienced surgeon, the cost becomes a factor.
Yes.
And that is something that we also understand. So what happens is there is a hierarchy of surgeons.
Okay.
All right. So even younger surgeons with a lot of experience who have spent a lot of time in learning and building their knowledge and their skills can perform very well as well. Okay. So, and these surgeons, obviously, when they are involved, the cost may not be as high as somebody who's really very, very experienced. So then you need to look at what the training of that surgeon has been. Where has that surgeon trained? How many such surgeries that surgeon has already performed. A young surgeon would have done a lot of tummy tuck for that matter, in a short period of time, and they are experienced enough to be able to do a good job as
So
well.
this is a place where age doesn't matter, but skill does.
Absolutely. Yeah.
I love that statement. All right. So on a final note, Dr. Sanjay, for anybody who is doing their R&D on tummy tuck, what would you like for them to know?
See, the one thing is they have to do many things, which means they have to educate themselves.
Right.
They really have to research. I think it's
Right.
not a decision that one would just make like this and that, okay, now this is the surgeon, I'll go and do the surgery. No.
Right. It's
They
not
should-
window shopping.
They need to go back, think about it, do a bit of research, see what actually the surgery involves, what information they have got matches with what is generally available out there, So they
Right.
need to prepare, they need to find the right surgeon. They need to make sure that not only experience but also somebody who's empathetic towards them. They
Yes.
understand the problem,
Right.
not just the problem of the body, but the social problem. They may
Very
have
true.
issues at home. They may have issues going back to work.
Very
A surgeon
true.
should be able to understand all of those and then give a plan that would
Yes.
help not only improve the condition but improve other help them manage better.
Very true.
So that's, I think, the one thing that I would tell them.
Right. No, that pretty much, I think, solves a lot of doubts I'm pretty sure that people have in their mind about tummy tuck, what it entails, and how we can help them. So thank you so much, Dr. Sanjay. So if you guys like this podcast on tummy tuck, make sure to like, share, and subscribe. And I'll see you guys on the next episode.